For any hospital or health system, the operating room is the primary engine of financial viability, often generating up to 70% of total hospital revenue. But this vital revenue engine is exceptionally vulnerable to staffing disruptions. When an anesthesia vacancy occurs, surgical suites sit idle, backlogs swell, and high-margin revenue is permanently lost. Historically, healthcare leaders have patched these critical clinical gaps with temporary contract labor. But today, what was meant to be a short-term temporary band-aid has mutated into an unsustainable financial leak. Specialized anesthesia recruitment platforms represent a major financial breakthrough, offering a strategic shield that stops this margin erosion and protects the hospital's bottom line. Hi, I'm Steve, your host for today's video. I'm pleased to bring you this special report and a new solution that can cut your staffing time to hire and hiring costs. The root of this staffing crisis is the sluggish pace of traditional clinical recruitment. Sourcing a permanent, board-certified anesthesiologist routinely takes 6 to 12 months, while recruiting mid-level anesthesia providers like CRNAs and CAAs averages 86 days. During these long vacant months, hospitals are trapped. To keep their operating suites running, they must pay extreme premiums for locum tenens coverage. Locum anesthesiologists command $400 to $475 per hour, resulting in staggering costs of $6,000 to $9,000 for a single 24-hour shift. Locum CRNAs command up to $325 per hour, and locum CAAs' average hourly cost is $215. A single 6-month vacancy can drain hundreds of thousands of dollars in premium clinical rates and staffing agency markups. Specialized anesthesia matching platforms provide a direct, high-velocity escape from this bridge coverage trap. If you're a chief financial officer, you know the economic decision to replace contract labor with permanent staff is supported by a precise, highly predictable mathematical tipping point, the 600-hour break-even model. Consider a standard CRNA staffing comparison. A temporary locum tenens CRNA costs $375 per hour. In contrast, a salaried permanent CRNA costs a fully loaded rate of $225 per hour, inclusive of benefits. This represents an immediate direct savings of $150 for every hour worked, with an average upfront investment of $90,000 for permanent recruitment, relocation, and onboarding. The salaried provider recoups their acquisition cost in just 15 weeks of standard clinical operations. Past this 600-hour threshold, every single hour that a permanent provider works yields a direct, bottom-line savings of $150 for the facility. Sourcing speed is a hospital's primary shield against excessive locum expenditures. Every single day a healthcare facility remains stuck in a traditional, slow-moving recruiting pipeline is another day of paying premium locum rates. High-velocity, specialized anesthesia recruitment platforms protect clinical margins by compressing the hiring cycle from several months to under 20 days. By maintaining immediate direct access to pre-screened databases of active anesthesiologists, CRNAs, and CAAs, these platforms eliminate the clinical coverage gaps that force recruitment teams to panic hire expensive contract labor. Closing a vacancy in under 3 weeks rather than 3 months saves healthcare facilities hundreds of thousands of dollars in temporary agency markups and administrative overhead. Compressing the hiring timeline also resolves massive downstream financial liabilities, particularly for contracted private practice models and agency placement overhead. By bypassing traditional external contingency firms, which charge 15 to 25% of a provider's first-year base salary, hospitals save up to $96,000 per anesthesiologist placement and over $50,000 per CRNA or CAA hire. Furthermore, hospitals spend an average of $2.3 million annually in subsidies to cover the deficits of contracted private practice anesthesia groups. Because these deficits are heavily driven by high recruitment fees and reliance on locums, rapid permanent sourcing directly lowers the group's operating costs, thereby shrinking the subsidy burden on the hospital treasury. Additionally, by matching anesthesiologists, CRNAs, and CAAs based on their precise clinical and scheduling preferences, these platforms drive a 15% increase in first-year retention, permanently keeping expensive temporary agencies off the books. Relying on locum tenens is a costly, short-term patch for a long-term staffing challenge. For healthcare executives looking to safeguard their operating room margins and optimize their balance sheets, the strategic path forward is clear. Replacing slow, traditional hiring with high-velocity, specialized anesthesia recruitment allows facilities to protect their clinical revenue, eliminate extreme contract staffing premiums, and build a highly stable, cost-effective clinical workforce. Jobs in Anesthesia is an anesthesia-specialized platform. HR departments at hospitals, recruiters at anesthesia groups, and ASCs can post jobs for free for 90 days. Thereafter, they can post as many jobs as they want for a low flat monthly fee. Then have your algorithms search our database for candidates' clinical specialties, preferences, career focus, and moving timeline that match your job opening. Make them an initial offer electronically through our system. If they agree with the match, they will share their CV, the balance of their profile, and contact information to begin communication. This streamlined approach will save your staff countless hours of time searching for the ideal candidate. Bottom line, lower time to hire and substantial cost savings. Relying on locum tenens is a costly, short-term patch for a long-term staffing challenge. If you found this video helpful, you may also enjoy our video, The Anesthesia Job Search Reversal, which goes into more detail about the new recruiting strategy adopted by jobs in anesthesia. Just click the video thumbnail that appeared above.